Hi everyone, I'm Dr. Anshu Mishra. I'm a board certified cosmetic and plastic surgeon practicing in Dubai. And today in this video, I'll be talking to you about what is gynecomastia surgery, what are the different grades of gynecomastia, and how the treatment varies according to the grade of gynecomastia. So let me begin with what is gynecomastia. It is an abnormal enlargement of the breast tissue in men, and the surgery entails removal of this excess breast tissue, thereby flattening and improving the chest contours. Now, depending on how much amount of fatty tissue is present and the glandular tissue, along with the degree of the skin laxity, there are different grades of gynecomastia. So in grade 1, there is mild tissue enlargement and there is a localized button-like tissue that can be felt just beneath the nipple areola complex. Whereas in grade 2, there is moderate tissue enlargement which exceeds beyond the boundaries of the areola, but it is not distinct with the rest of the chest. In grade 3, there is again moderate tissue enlargement which goes beyond the boundaries of the areola, but along with this there is moderate degree of skin laxity also present. In grade 4, there is a severe breast enlargement with severe skin laxity which gives an appearance of a female-like breast. So depending on whether it's just a fatty tissue or along with the glandular tissue, the treatment may entail either liposuction alone or excision of glandular tissue, or a combination of liposuction and excision of glandular tissue. In some patients who have lost a lot of weight might have the severe skin laxity in the chest. So in those cases, the excisional surgery may be required where the excess skin tissue is removed. Along with that, repositioning of the nipple areola complex is done. Now, it is very important to differentiate between gynecomastia and pseudogynecomastia. In pseudogynecomastia, it is just the accumulation of the fatty tissue with no enlargement of the glandular tissue, and the treatment generally entails liposuction alone. I have made the video on pseudogynecomastia and how to differentiate between the two. The link is given in the description box below. You can check that out. So depending on the grade, if your surgeon decides to go ahead with liposuction, then that is generally done using small incisions in the hidden areas and using special instruments called cannulas, where the excess fatty tissue is removed from the chest, thereby contouring your chest. So there are different types of liposuction that can be done, either suction-assisted liposuction, power-assisted liposuction, or ultrasound-assisted liposuction, which is known as laser. And depending on your assessment, your surgeon would decide on what type of liposuction needs to be performed. The other treatment is the excision of the glandular tissue. It is basically done in patients who have just the enlargement of the glandular tissue, giving a puffy appearance to the nipple with very little amount of fatty tissue. It is particularly seen in athletes or in bodybuilders, and just the excision of the glandular tissue using an incision in the areola will treat such condition. In some patients, combination of liposuction and excision of glandular tissue needs to be done if there is excess fatty tissue along with a tough glandular tissue present. Gynecomastia is a very gratifying surgery and it can really boost your self-confidence. I have talked about what are the different grades of gynecomastia and what are the different treatment options available according to the grade. If you still have questions, feel free to write in to us. I will be happy to answer. To watch the other cosmetic surgery related videos, you can subscribe to our YouTube channel. I'm also available in other platforms like Instagram and Facebook. Thank you.